So it's not only Giedre, it's also me, because Giedre is currently in the US on a Fulbright grant at Johns Hopkins Business School. So congratulations to that for this. So she can't be here today. I'm, as you just quickly saw, from Siemens Healthineers, but I'm also the co-chair, the chair of the COSIR Interoperability Focus Group. But nevertheless, Giedre will do the talk, and if there's something that you want to discuss then further, I will be around. So over to you, Giedre.
Thank you very much, and it's a great pleasure to be able to be here with you, at least this way, because I really looked forward. To be in person. Now, if you just give me a second, I will share my, can I share my screen, the presentation? I can, right? Yes. Excellent. So first of all, thank you very much for previous presenter, John. It was really interesting for me to listen to very practical, I would say, not even use the word technical presentation of data interoperability and exchange. And I absolutely agree that it's about patients' needs and society needs, not about technical aspects to be able to share the data. So what I will try to do today is to shed some light on what is happening in related policy that we all hope would enable data interoperability even further and support all the great work that you guys are doing. So to start with, I hope that everyone knows COSIR, but if there are anyone who doesn't, then I'd like to briefly introduce. So COSIR is a non-profit trade association, one of the oldest and respected ones in Brussels, founded in 1959. First in Frankfurt and then moving to Brussels. We represent 4 major areas of medical devices manufacturers, that is medical imaging, radiation therapy, electromedical equipment, and digital health. So while being focused on EU policy primarily, we also, of course, are very active and present on the global level, making sure that interoperability is truly global as well, and we operate through data in that field. So without further delay, let me take you to the main topic of my speech today. And before I jump to the European Health Data Space, which is obviously one of the key policy pieces of interest for many of us this year, I'd like to take one step backwards and just look into the context of how policy makers perceive this digital transition, which is already ongoing for quite some years. So to start with, I think it would be worth to go back to European Commission's Declaration of European Digital Rights and Principles. What is very important to always have in mind that policymakers do not see anything, well, not anything, but do not see these developments as of technical nature, or do not put the technical aspect in the center. But what they do, they actually take a standpoint from digital rights and principles, and they stress the importance of people centricity, sustainability, solidarity and inclusion, safety and security, freedom of choice and participation. And those principles, they guide the whole logic of policy making, which in principle, of course, is something that we all support. However, in certain cases, then you have to bring those concepts back down to the practical aspects, and especially once you touch the technical aspects of it, sometimes it becomes a little tricky. So digital transformation of healthcare there is no dispute that data plays a central role in the whole process. And what is important to say, I'm sorry, I need just quickly make tiny adjustment. So what is important to say that there are 3 goals, broad goals, you could put it that way, that is to ensure that citizens have secure access and sharing of health data across the borders. So there is a lot of course, debates and discussions, not only on technical level, but also across policymakers on national level and at the EU level. Then everyone is interested in better data, and that also goes back to the previous discussion, you know, that content is critical. And I mean, the technical solutions can provide instruments. However, it's very important that the clinical society, as well as the wider society, would really take care of establishing right processes and right behavioral attitudes to ensure that we do, in fact, make those inputs needed for better data. And last but not the least, of course, are digital tools for citizen empowerment and person-centered care. Now, the problems that we have in healthcare in relation to data and data interoperability are found on every layer, and we all know them. Starting from difficulty for the patient to access his or her own health data, but so is difficulties experienced by healthcare professionals and clinical institutions to share the data, to use the data, to be confident that the data is of sufficient quality to make the medical decisions. And that also kicks back to, I would say, quality sometimes of policy making, of having informed decisions on what exactly is needed in terms of regulation to foster data use instead of building further barriers. And of course, it also presents barriers to more efficient and effective research and development, use of data for that. So now going to IHE-DS, which is seen as a game changer in healthcare, let's try to have a look at some key aspects. I'm pretty sure that probably you have seen those slides before, but nevertheless, the Commission sees it as built on 4 major building blocks, if you could say so, 4 major goals. So the first one is sharing of health data for healthcare. Another one is single market for digital health products and services. It's also about access to health data for research, innovation, public health policy making, which is labeled as secondary health data use, and to use it for the development of artificial intelligence. Without going through all the problems and areas of work to be done, it is clear that at least in the first 2 pillars, which relate to sharing of health data for healthcare, as well as single market for digital healthcare products and services, is the area where interoperability solutions are of critical importance and should be really taken care of not only by experts of interoperability, but also, I would say, ideally, it would be really good to bring those knowledge, competences, and insights into policy making as much as we can. So what happens is that IHE-DS comes into already existing quite complex legislative environment, which is already regulating a lot of things that you guys are doing, which end up in health products and services, medical devices, therapies, you name it. So IHE-DS aims to propose common infrastructure framework. It hopes to empower patients. Of course, the primary goal is to use data for research, policy making, and well, to use it for health provision, first of all, but also for research policy making and regulatory decisions. And as I mentioned before, clarify the use of AI in health. Now, what happens is that since EHDS comes into field where already we have other established regulations, which are more focused on other aspects, you could say, than exactly data itself, it gives us areas of both duplication, but even worse is some major lacks of harmonization between different regulations, such as General Data Protection Regulation, Medical Device Regulation, even the same Data Act regulation. We see some inconsistencies, and with Artificial Intelligence Act as well. So where does it take it? Because of those overlaps and lack of harmonization, which I will briefly discuss once I get to our recommendations, it basically gives three major blocks of limitations of the possible impact of EHDS. So the first one is legal uncertainty, and EHDS currently is not properly aligned with GDPR and the proposed Data Act. So of course, given that we deal with a lot of personal data, and also having that in mind that Data Act, which is a horizontal legislation, while it has to be fully harmonized with the EHDS, which is sectorial legislation, to make sure that all the participants really understand how to comply with all the applicable laws. We also believe that there is insufficient distinction between data holder use and data recipient, while in terms of interoperability, probably it's not such an important problem for technical experts, because they obviously have those definitions rather clearly defined through all the documentation. But legally, that again leads us to problems of previously mentioned. There are concerns whenever we will achieve this better data quality if we have blurred distinctions and lack of clarity of who is responsible for what, which takes me to the third point of that. Now, the other two blocks are the ones where, in fact, the developments that you are doing, and not only the technical developments, but I would say what is very important, communication of them and translation into key messages and key points for policy makers is very important. That relates to risk management, that it is of critical importance to make sure that EHDS, as well as any other legislations, they support international data interoperability standards rather than make it governed by EU requirements only, which are not fully aligned with what is happening on the global arena. It is also very important to make sure that next to the aims to empower patients' access to data and use of it for their own personal needs, as well as the aim to foster secondary use of data for research and development and for policy making, protection of IP rights and trade secrets, as well as fair cost coverage must be secured to make sure that we keep the incentives, in fact, to produce the data and to produce the digital instruments to provide that data for the wider use. And also the third point from risk management is, as we see it, is that mechanisms for data provision for public interest are complicated, and we believe that they should be simplified in order, again, to sustain transparency and fairness on the market. And last bit of concerns, which we grouped as potential fragmentation. Well, the restrictions of non-personal data processing to third countries for secondary use purposes, we see it as a potential barrier to in research and development in some cases. For example, on rare diseases, as well as we do see that there is insufficient harmonization between national frameworks of the EHDS, and and that's, I hope that it will not take us to the situation where we will have a policy piece which looks very logical on a paper. However, once you get to the implementation stage, it takes years, if not decades, to really get it right. There are two, I would say, quite important pieces of opinion by European Data Protection Board and EDPS about the European health data space. So I highlighted a few points, few messages that they are making, which I see of either concern or support for the industry. So, so the first one is that one of the joint opinions calls to limit data storage in the EU and European Economic Area. Again, from legal perspective, I could understand such arguments. However, once again, we have to be very careful with that if we do not have an intention to undermine the value of both in the primary health data use, but also in the secondary one, given that, especially in a sector like healthcare, it is global already for many years, and it was widely recognized that it is in the interest of patients to really remove all the barriers for product development and improvement. And and what we support, on the other hand, is called to clarify task competencies and cooperation of the public bodies, meaning that at the moment, because of course the subject is complex, policy proposal tries to be as flexible and kind of leave agility for national authorities to adapt, but at the same time it brings a lot of complexity, which is rather difficult to navigate, even while trying to envision the deployment of policy. But everyone is quite worried that that would be also the case once the legislation is passed. And one more concern, which is more about sharing data, not from a technical perspective, is that there are deep concerns regarding the obligation to make data available to public sector bodies and union institutions, agencies, or bodies in case of exceptional needs. And in the light of fragmented and incoherent supervision, well, what is meant here is that EHDS imposes several things. First, of course, it wants to enable policymakers to have access to all data needed to address some urgent situations, like the most famous currently, of course, is COVID-19, in a fast and efficient way. However, in other cases, it is also embedded that EHDS would allow them to share that data with third parties for other purposes than the primary goal, and that really creates problems for data privacy, IP rights, and other things which I mentioned previously. So taking from there, we have developed quite a few recommendations for European health data space proposal improvement. To start with, so in terms of primary use of electronic health data, we do strongly believe that interoperability along the existing and internationally recognized standards, as well as semantic and technical interoperability aspects, should be strengthened and promoted in the legislation more explicitly and more concretely. The other part is the protection of IP rights and trade secrets should again be taken better care of in the wording of the legislation. We also believe that more simple and more standardized principles should be applied for data provision to the public interest to minimize subjectivity and ensure better comparability and transparency. What we mean here is that in order to support small and medium enterprises, the HDS envisions that data holders should adjust the pricing of data provision, basically, which should be the costs, to accommodate the size of the company or the budget available for that data. So really, the way it is formulated right now, it leaves a lot of subjectivity and lack of basic guidance, how to evaluate the size or the capacity of some smaller companies to set the cost for data provision, which will clearly suggest that it will not be covering all full actual cost of doing that. And then to ensure that obligations to collect, store, and provide data under Annex 3 are limited to information that is relevant to the intended purpose of the device or system, because as the EHDS as well as Data Act are currently formulated, it's really not clear where the scope of the data to be stored and to be provided really should limit. And even from a technical perspective, remains an open question, so how everything should be done to make sure that we fully comply with the HDS. So therefore, we ask for clarity so that it will be clear what exactly is expected from medical device manufacturers. Now, electronic health record systems and wellness applications, basically without going through every point, what we advocate and that is in fact the opposite of the advice, is to give wellness app developers access to the same data sharing pools, and that they are equal participants. Patients' perspective, that without those wellness applications, health prevention really becomes only partial, I would say. Secondary use of electronic health data, it's about research and development as well as policy making. So we do call for better alignment with GDPR for the reasons that I explained before. We also think that more clarity on provision of electronic health data entailing protected intellectual property should be introduced. That health-related private legal entities as well as wellness developers, wellness applications developers should be more clearly included into the users of access to secondary health data, because right now, even though you kind of understand that you are part of that, however, reading some parts of some articles in the regulation, it really becomes confused whenever health-related private legal entities are part of secondary health data use community. And of course, to ensure proper cost coverage for data provision, which is at the moment limited only to the final step, which is cost of providing data, completely ignoring the cost of preparing data and aggregating it. Now, also restrictions on non-personal data movement to third countries, as I mentioned before, is something that we have concerns about. And again, national frameworks for implementing HDS and safeguarding performance, they are really important to have a united and integrated and sustainable, which was, as you remember, some of the goals from digital rights declaration to be really addressed by the IHDS. That's it from me today. Thank you very much for your attention. I hope I did not overuse the time too much.
Not too much, but a little bit. I think we are all ready for those that are left to go and join our lunch. I would invite, if you have questions, to contact Andreas, and Andreas could either respond or forward and interact with COSIR on addressing your concern. Thank you very much for your presentation. That was an interesting policy perspective, quite different from what we've heard from the folks on the cross-border record format and interoperability perspective. You did not mention the fact that there was some intent to mandate certain interoperability standards at the European level into the countries, which I find completely unrealistic, but another topic from discussion. I think COSIR should work on that so that we have policies that are applicable and not pie in the sky. Thank you very much for your attention. Thank you.